And we're live. All right, so this is Senate Health and Welfare. We're back live on January 16th. And we have our healthcare advocate here with us, so why don't you come up and introduce yourself? We have two healthcare advocates.
Right.
We're going to introduce ourselves in case you don't know everyone around the table, but new folks.
Okay.
And then we'll ask you to introduce yourself. Senator Hart.
I'm Senator Hart from Orange County.
Senator Santos from Orleans County.
Senator Lyons, Chittenden Southeast.
Senator Gulick.
And me.
Senator Cummings. It's,
Hi, I'm Emma Lavins. I live in Montpelier, but I grew up in Orange County in Randolph.
and I'm Mike Fisher, Chief Healthcare Advocate. We just spent,
Terrific, thank you. Go ahead.
we just spent an hour in healthcare doing this presentation, and we actually went over by 10 minutes. So we're not going to be able to do the full presentation here.
So we're looking for kind of the global picture, and we will have you back. And I'm sure we'll have you back more than
Yeah.
once.
So I think I was thinking, Emma, as I was walking here, that go ahead. That we not speed, but instead pick and choose the few places to cover.
Sure.
So the Healthcare Advocates Office is defined in state statute, and I've been in this role since 2017, and for the two new members, I also served in the House for 14 years. So I've been studying this process for a long time. I think I've figured it out, and then I go into a new session. I think I don't know what's going on. But so it's 2 years. Yes,
You finally got out.
yeah. So we through an RFP process, we landed at Vermont Legal Aid, and the Healthcare Advocates Office has been at Legal Aid since its inception in 98, 99. That's when it started. Yeah. There's the 15 of us. And we're a free resource. You just have to be a Vermonter. We are a resource to help people maneuver through this really complex system. And just to recognize, we're not part of the state, we're independent, and we are not part of an insurance company. We are in an advocacy office, and in some ways a watchdog office of the healthcare system.
All right, and so let's talk a little bit more. So I'm a health policy analyst at the Healthcare Advocates Office. I work closely with Mike, and we have a policy team, which is the team that I work on. We advocate on behalf of Vermonters through the legislature, and we also with the Green Mountain Care Board, the Department of Vermont Health Access, DEVA, and the Department of Financial Regulation. We're essentially a consumer watchdog, so we're looking to sort of advocate on behalf of Vermonters throughout all parts of the healthcare system. But we also have an amazing advocacy team. They are brilliant and creative, and they are on the front lines, answering phone calls, sending emails. They advise, advocate, research issues, and occasionally represent Vermonters. And you are often your constituents if they are having a struggle with the healthcare world, which many of us do often.
And let me just recognize, today is the 16th, it's January 16th. Yesterday was the close of the Qualified Health Plan open enrollment period. And we just had a open enrollment period for Medicare as well. And this was a tough season. And it was a tough season for my team, for our team, because it was a tough season for Vermonters. So we were busy. We had a lot of very complex cases, and we have a lot of interaction with people who are pretty frustrated and upset and angry and scared about how they're going to make it, how they're going to make it financially, how they're going to be able to get the care for themselves and their loved ones. So I understand their anger and concern.
And the advocacy team, just really quick, they can help with all kinds of issues. If in doubt, call us. They work with people on access to care issues, if they're struggling to get the care they need, eligibility for state and federal healthcare programs, all types of consumer education, all types of healthcare billing problems, healthcare complaints, and buying insurance, you name it. We work on it all.
So we have 4 case examples we're not going to do. But I'll just say, this is Macy, and she's a straightforward one, someone who was on Medicaid and graduated from college and becomes eligible for Vermont Health Care. And
We have many examples here, and I think that this PowerPoint will be shared with you all. They're just examples of the types of cases that we would work on to give you a flavor.
let's just do the Rodriguez family example is a story about family glitch and the challenges people have when due to a problem in the Affordable Care Act rules and the fix that the Biden administration was able to do to solve that problem. And here's a story about Cecilia, who is a single woman who is pregnant and is undocumented. And the programs that your committee helped us set up and the administration now, the DEVA now runs for the IHID program to cover Cecilia due to her pregnancy. We do for children in pregnancy. And then the last example is Jackson, who is a story about somebody whose income falls this year in a level where they'll get support for their Medicare premiums. But due to the legislature's actions last year, starting in January, they will Jackson will qualify for the level of support to cover his cost sharing as well.
I think it will be
I was trying to
helpful.
remember what we did last year.
Yeah, we did that. We did that.
We did a lot of good stuff.
We did that.
Yeah.
But it will be helpful. As the committee becomes more in tune with Medicare and Medicaid.
Yeah.
To have you come back and walk through these examples, because I think they're very
Yeah.
helpful in understanding.
Yeah.
Payment.
So I know I just sped through it very fast due to our time constraints, but it just makes sense to us to put it in the context of these are composite stories, they're not their real names or pictures or anything. But these are the types of cases that come to us, Vermonters that come to us with these kinds of challenges. And it may look simple to us, but it is it represents a tremendous amount of stress for Vermonters when they're trying to figure it out.
It's a lot of progress.
Yeah.
This is a quick how to get in touch with us. The advocacy team. You can of course always email Mike directly or myself or anybody. But that is our phone number. Our website. There's an online form folks can fill out. You could send constituents to, or you can always email the advocacy team. There's always somebody checking that account and pulling and creating new cases and getting back to folks. So, if you get contacted by someone who's having a healthcare crisis problem, you're stuck in the maze, feel free to reach out to us.
And I have to tell you how effective that is. I've had many folks contact me and send them directly to the healthcare advocate's office legally.
So let me just say a word about that. People who come to us through legislators are a little bit more stressed, a little bit, they don't know where to turn. They're a little bit, lots of people come to us because they look it up or they see our notice on an insurance form or Medicaid form. We get a decent amount of referrals through you, and they're important referrals because they're people who don't know how to find us in another one. And so I want to encourage you, if you want to give out the phone number for someone to call the healthcare advocate's office, they should call that number. But if you have somebody who's emailed you and don't know where to turn, looking for advice about how to respond, or you're looking for someone, you can feel free to reach out to me directly. I'm in the building and I have a card for anyone who needs a small. Yes. Because I want to help people get through, even our system. There should be no wrong door. There's just one note on this. If you want to refer someone to us, all we need is permission from them for us to reach back out to them. If you say, I've talked to them and they know I'm referring, great, we need their contact information, we'll call them. Sometimes legislators say, what should I do about this? And I say, you should refer them. Do they know we want to call them? They say, and the legislator says, well, let me reach out to them. And the days pass and sometimes weeks pass because the legislators are busy and not caseworkers. So a little patting ourselves and you on the back here. This past year, our advocates in direct advocacy for Vermonters, sort of one by one, saved Vermonters $3.6 million. And that's a conservative estimate. I want to remind you that our appropriation is just over $2 million. Last year, you gave us an increase last year. Last year, it was $1.8 million. We are not asking for an increase, but just to put both sides on the equation. Thank you very much for your work on the Medicare Savings Program. It goes into effect next year. It has an estimated value of $48.1 million to Vermonters in improved advocacy care. That's not cash in their pockets.
Just want to say that this committee worked on that very hard, and the appropriations committee, we took it down the hallway and worked closely with appropriations as well as with the administration and made a difference.
Yeah. And then lastly, we worked for a number of years on a silver loading strategy, which is in place this year. It did not require legislative action. It was something we advocated in front of the Green Mountain Care Board with support from parts of state government, other parts of state government, and it's in place this year. The Green Mountain Care Board's actuary estimated the value of it is $40 million this year. That required no state match. It was all federal dollars. Improvements to the quality, to the richness of their insurance, so they get better care. That's just under $100 million. So, good work.
And always just invisible to the real world.
And then we have to just say, money is an easy thing to count. And so it's an easy thing to put on a slide. The example a couple pages back of Cecilia, who was an immigrant, was an undocumented person who needed care coverage for her and her pregnancy, doesn't show up on here. There's a human story behind this as well that I think is fully interesting. So we just at least wanted to put on the page a few things that we're going to be advocating for this year. I'm not going to do any of them in any detail. There will be time for us to talk about it in more detail. But I do want to pause for just a second on the last bullet and recognize the level of crisis that we experience wherever I turn. Be it community health centers, be it hospitals, be it independent providers, be it Vermonters, be it taxpayers who are paying for public employees' insurance, small businesses, large businesses. I'm not sure who I've left out. This system doesn't feel like it's working. I know who I've done. And insurance companies. I think you saw an email from Don George yesterday or the day before saying both were okay, but also saying we really have to deal with the price of the system. About a month ago, Blue Cross had a press release about a downgrade in their rating. We have a lot of stress in our insurance companies, and I guess I want to say from my perspective, it is very concerning. And I think I won't do more details than that, than to say, the stability of our, carriers is an area of concern. And it really does boil down, in my mind, to the prices of the care that people get here in Vermont. And you can't explain it, in my opinion, you can't explain it away with the simple, it's the demographics. Maine is older than Vermont. And Maine is not experiencing the same pricing problems that I think Vermont is experiencing. So it's more complex than that. And I think there are tools in front of us to address it. But it's going to be hard. I want to recognize that this is going to be a hard thing to address. And as the advocate, of course, I want the very best care in every single community around the state. I don't want people to have to drive a long distance for care. And we have to have a theory about how we're going to pay for it. We have to actually be paying for it, and not even, my fear at this moment is that we're not paying for it, and that it will drive parts of the healthcare delivery system out of business. So there's my welcome to the section.
Well, this is exactly, to be honest with you, this is exactly the level, right, that's appropriate right now and very helpful.
Yep.
And we see your priorities, and some of those priorities resonate with our priorities that we'll be looking at during the session. And I see you have the green cards,
So
right? And you hand those out? Or
yes, yes. I haven't counted them, so we'll see how far that goes. So this, you may have one from last year. It's out of date. I try and change the color every time I pass it out. This will be out of date in
March.
March,
Well, when FPL comes out.
and we'll give you a new one. I guess warning, if you're looking for, like, what is this program and what's the eligibility for it, sort of a high level, it's a great resource. But if you have somebody who needs some help, it's more complex than this. And so please refer them to us. I'm sure I left out 10,000 things. But thank you for a little time.
This is great. No, this is a good introduction, and we'll get into the weeds going forward. Thank you. Thank you both.
Waiting for me, it's 71.
So we're gonna move on,
Probably some legal work.
and we're gonna invite,
71. And if you could call him.
So can I just,
Which did you
can I just respond publicly for a second? Excellent. Okay.
Sounds.
Okay.
You can ring.
so what we're getting
Thank you.
introduced are, the next is another huge umbrella. And I've asked, Agency of Human Services to come in, and the Secretary Sanderson, thank you for being here. You have a team, you want all to work together? Okay, so Christian and Monica. Why don't we just pull 3 chairs up? Yeah.
Okay, thank you.
And we are going to go through your committee introduction one more time. Thank you. Yeah. So we'll start, with Senator McCollum.
Hi, Gwen Cummings, second Senate, right here, Washington District.
Martin Laurent-Kulik, I live in Burlington and represent Chittenden Central.
Jenny Lyons representing Chittenden Southeast.
Sam Douglas, representing Orleans County. I live in Troy.
Larry Hart, representing Orange County, live in Thompson.
We're good. So why don't you introduce yourselves for the record, and then we welcome your
testimony.
For the record, I'm Jenny Samuelson, and I'm the Secretary for the Agency of Human Services here in Vermont, and I'm joined by my deputy.
Good morning. For the record, I'm Kristen McClure. I'm the Deputy Secretary of the agency. Morning. I am Monica Ogilvy. I am part of the executive leadership team at the Agency of Human Services and the State Medicaid Director. Thanks for having us.
Oh, are we going to be in touch with you, right?
I am looking so forward to that.
We're going to be in touch with each one of you.
This brings us one.
Oh, that's okay.
And Chair, thank you for allowing us to bring our entire or a portion of our executive team this morning. Our goal this morning is to help introduce you not just to the agency, but to who you may go to. So in addition to the Deputy Secretary and our Medicaid Director, we also have Brendan Atwood with us today, who is our Policy Director at the Agency of Human Services. Our second goal will be to go through kind of the breadth of what the agency covers and scope to give a general overview. And Chair, which would you prefer for us to take questions as we go or to hold them until the end?
Really, that's up to you. I think getting through the entire presentation is important. The committee has been pretty silent with questions. So if something pops up, we know it's really important.
Great. So my preference is to take questions as we go. If we end up slowing us down too much, then maybe we'll pause and reconsider that. So the Agency of Human Services is the largest agency in state government. Our mission is to improve the condition and well-being of Vermonters. And that's really all Vermonters. The breadth goes from prevention all the way up to the most complex care. Our vision is that Vermont is a place where all people have the opportunity to thrive in an equitable and resilient community. And as you look at the breadth and the scope, I think you'll be able to see that through the unity of the departments that we have, we are able to achieve much of that or support much of that vision. The agency has 6 departments, and we'll walk through what those are in a moment. And that the goal of that is to effectively manage and deliver a wide range of human services. And it allows us to really both specialize in each one of our departments so that we have someone who is able to go deep and to focus on the specific needs of whether it's prevention or whether it's a specific population, to really understand what those needs are, understand what the best practices are, to seek that out both in the state and to be cognizant of what's happening at the federal and international level. We also, one of our core values that you'll see is collaboration. For us, collaboration isn't just a catchphrase, it's really imperative to the work that we do. We know that if we are going to have these specializations, that we need to be able, that most of the individuals, families, and communities that we serve, that the issues that we address go across each one of our departments. And so for us, collaboration across the programs is a key component of that. And that really helps us to achieve effective delivery. The agency manages a significant number of complex cases, and it also allows us to maximize federal funds. As I think Medicaid, and as Monica goes, our Medicaid director goes through the programs, it allows us really to look at bringing in federal funds in the programs, but to make sure that we're able to still do that in a comprehensive, whole community, whole family, and whole person approach. So the agency is made up of the central office and the secretary's office, and our goal really is to facilitate that collaboration, to facilitate innovation across the agency. And as such, our secretary's office is made up of healthcare reform, which really allows us to drive health and human services reform across the systems. We are constantly looking for innovation in the payment space, in the way the services are delivered, in the way that we are collecting data and managing technology, and health reform is really a significant component of that. We also have the Medicaid program director, because as you'll see, oftentimes people think of one of our departments, the Department for Vermont Health Access, as Medicaid, but essentially our Medicaid program crosses over multiple departments, with our Department for Disabilities and Aging, Independent Living, our Department for Mental Health, managing a significant component of our programs. Under health reform is the Blueprint for Health, which has really driven some of that clinical innovation on the ground. And then we have health information technology that allows us to facilitate the aggregation and analysis of data to drive the direction that our agency and our systems are going. It's important to note here, while the Agency of Human Services may be large, the footprint we have on the ground is significant. The majority of the services that you'll see that our departments monitor, what the needs of our Vermonters, and the delivery of those services happens through a network of primarily nonprofit organizations that are community-based in each one of our communities, and that's an important component. So our 6 departments are the Department for Public Health, and we'll go through each one of the departments towards the end and walk through what their mission and their vision is. It's the Department of Public Health, Department for Disabilities, Aging, and Independent Living, the Department for Vermont Health Access, Department for Mental Health, Corrections, and the Department for Children and Families. The one thing I want to point out is that Vermont is similar to many other states in the sense that we have one Uber agency that allows us to do that coordination. But what is unique here is that Vermont has made the decision that when we think about our corrections populations, our goal really is rehabilitation and to really ensure that we're addressing the root causes of an individual's incarceration or criminal behavior, so that we're able to address those root causes through mental health, substance use, healthcare service delivery in our correctional system, ensuring that we've got employment and training. And so Department of Corrections, being a department for the Agency of Human Services, is unique, and we think has provided a significant amount of value for the state. So our leadership team at the central office level includes myself, and I wanted to make sure everyone had a chance to see team members of our leadership team today, so that you could put a name to a face and know that we are accessible. Many of us will be in the building. We're also only an email or phone call away. We have our Deputy Secretary, Kristen McClure, Monica Ogilvy, who is our Medicaid director and really driving the programs in those Medicaid-oriented departments. Brendan Krause, who is the Director of Healthcare Reform. Rich Donahue, who is the Chief Financial Officer for our agency, and then Brendan Patel. And again, I encourage you to reach out to any one of our senior leadership team members. And each one of those people represents a function in our central office. While we have a core mission and vision that I've walked through, many people ask us about what our values and our approach are. We can't speak about the agency without speaking about these. Really, as an agency, we value transparency. So making sure that the work that we do is that we talk about it publicly, that we're open and honest about the things that are going well, the things that aren't going well, and that we are soliciting feedback and input on what the changes are. We know that the environment changes constantly around Vermonters, and so we want to continuously evolve our program. So that transparency is important. For us, integrity in the way that we do our work is key, ensuring that we are hewing to a strong set of the ethical values, and that's held across all of our departments. And you again see that in the transparency of us making sure that when something goes wrong, that we're upfront about it and that we address it, as well as making sure that we're promoting things through well. And then I'm privileged to work for an agency where service really is the core. We have many staff members who can work in lots of different places, and the work would be easier and potentially more financially lucrative. But the people who are at the agency there are to serve Vermonters, and to ensure that whether we're talking about housing and homelessness, or we're talking about economic benefits or healthcare benefits, really people are there to serve and meet the needs of Vermonters. Because the environment is constantly changing, the way that we approach our work is to constantly look for innovations. How do we evolve to the circumstances around us? How do we collaborate across the boundaries of departments within our own agency, with community organizations, and with other agencies and state government? Because without that level of collaboration, we can't be effective in delivering programs. And then again, we've got one of the most dedicated staff in state government. So the Agency of Human Services, as I said, is one of the largest agencies, both fiscally and from the standpoint of the size of our organization. Our budget is complicated, and folks will come in and we'll explain that in more detail. Bring Rich Donahue and do that. We are about $1.3 billion of general fund, and about $5.2 billion across our programs with the federal and other funds that come in order to support the work that we do. From a position standpoint, the Agency of Human Services is a little over 4,000 dedicated employees to serving Vermonters. And then I'm gonna hand it over to our deputy to speak a little bit more in depth. In addition to the work that we do from our central agency, the key is really to deliver services at the local level. I'm gonna let Deputy Secretary.
The secretary mentioned there's departments within the agency, and there are 12 district offices located within each district. And within those district offices, there are distinct services that are provided at a local level. So Vermonters can go in and receive those services. So each district office has a specific field services director assigned to that. There is one field service director assigned to 2 districts, and that's the reason for the color coding. And they're really a high level AHS director position to really liaison with legislators, with the community, with municipal leaders to help solve some of the more complex problems in the community. So they're a direct outreach person for you and for the local community. Also within the district offices, healthcare services are provided. So there are nurses there as well that provide wellness and health support, as well as the nurses that work on some of the most complex cases, and that's known as the Vermont Chronic Care Initiative. So really connecting some of the more complicated cases and connecting the provider network around that to have a team-based care approach. Family services also are in the district offices, so supports that are needed for families and services, whether it's around adoption or foster care or ensuring child safety. Also in the district offices are economic supports, and we often think about that as food support, for temporary housing, for fuel, for case management to help understand all the benefits an individual can be eligible for. Also in the district offices, there's employment and job training support, really for those with physical disabilities or intellectual disabilities. And in the field offices, there's parole and probation. So this provides the supervision, rehabilitation programs, and ensuring completion of court-ordered sentences such as parole and probation. So now we're going to step into the departments in a little more detail. We'll start with the Department of Corrections, and we have on the left a map of the different facilities. So there's 6 different facilities in the system. 5 are male facilities, and there's 1 female facility. There's also an out-of-state facility. And we did talk about the probation and parole offices throughout the state. One of the items that is unique to Vermont is the Department of Corrections offers a unified system. And the way we think about that is pretrial services supervision. So before people go to trial, people that are detained, so they haven't yet gone to trial, as well as those who are incarcerated and sentenced already. And then through the full spectrum of parole and probation, community supervision. So a full end-to-end approach. And then it's also worth noting in the northeast of the state is the training facility. So all correctional officers do go to the training facility. So it's standardized training for all officers.
Okay.
Exactly.
Morning. I really just want to thank you for having us and invite especially new committee members for Jutland County. Medicaid in particular is complicated, and no one knows that more than myself and the members we are serving. And so I really try to bridge that gap and would like to be a resource for you just as much as we are for the members. The Department of Disabilities, Aging and Independent Living. This we fondly refer to as DAIL. That's their preferred acronym. When you think of DAIL, their mission is to make Vermont the best state in which people can grow old and live with a disability with dignity, respect, and independence. So when you think of DAIL, think about maybe loved ones, your neighbors that are in a nursing home or maybe at home, growing older with additional supports that maybe help them with bathing or feeding, getting dressed, accessing the community. DAIL does a lot to support our aging demographic in Vermont through their Age Wells program and through a network of different areas of aging and independent living throughout the state. They also help with disability services and supports for Vermonters of all ages that might have a disability or an intellectual disability through a variety of different services, and also through our network of designated agencies that are all throughout the state of Vermont. And they also touch on other things that might mean something too, like the Office of Public Guardian. So for individuals that maybe can't speak for themselves, they coordinate an entire office of individuals that are there to help support and advocate on their behalf. So DAIL has a huge number of programs and services and supports under them. They're largely funded by Medicaid. And I would certainly encourage you to invite them to come back and speak in more specificity about their programming if that's of interest. The next department I'm going to cover is the Department of Mental Health. You might hear people call it DMH. Their mission is to promote and improve the health of Vermonters. They do have one facility, the Vermont Psychiatric Hospital, but they're also very much in our community and in our schools, providing services for people that have identified a need. They've also done a lot of really incredible work over the past few years to start new programs that really help people get access to mental health services and supports really early. So anybody in the state can pick up the phone and dial 988 and get help immediately. If they can't get the help they need over the phone, we have now a mobile crisis program where they can actually send people out to where you are to help and support you. And then from there, if you need additional support, then they can help provide that. So they've done a lot by way of not only creating spaces and opportunities for people to get access to services really early on when they're feeling distressed or experiencing a crisis, but then also to support them throughout the continuum, whatever their mental health needs are.
We ever heard of We Are Hope?
I haven't. I'd love to hear more about it.
We Are Hope is done by Sean Perry.
Okay.
He's out of Springfield, Vermont. He has mental health advocates in every school that you could possibly get him in. And it's called We, capital R, capital HOPE. And his name is Sean Perry, SEAN. And he had mental health issues himself. And as an adult, he decided to create this program. So most of the schools, and he's all over the Northeast now,
Yeah.
and he's also in Africa. He has people in Africa as well. So he's out there helping people with mental health, the kids with mental health, only children. That's all he works with his schools.
I'm willing to bet our DMH colleagues know him well.
Yeah, and I'm going to give you his phone number. Right?
So when we start going through what's next in the mental health world, this might be someone to bring in from the community.
Be great.
Yeah.
He's amazing. His mobile phone number, that's where he usually answers.
Wait, I would prefer you didn't give it live. Thank you. Yeah. I'd be careful.
Well, as we're exchanging phone numbers, I think, as you'll see, we've got the Department of Mental Health, and we've got the Department of Health. And within both of them, Monica has spoken really eloquently about 988 mobile crisis, mental health urgent care. As we move forward, one of the agency's priorities is really to continue to strengthen our mental health and substance use systems of care and to really ensure that we're doing co-occurring care. And so as we look forward and we're going to continue to really coalesce and ensure that that the individuals who are seeking mental health services and substance use services, because there is significant overlap, we're able to get those from the same providers. And then we've got measures that are tracking co-occurring, and then we've got payment methodologies that are co-occurring, and then we're filling the gaps in both systems because we know, particularly post the pandemic, that our mental health and substance use systems of care really had needed to evolve and to be strengthened. So thank you for bringing up that resource, and note that mental health and substance use, in particular the co-occurring nature of them, is a priority one of the priorities of the agency.
Just a quick question. How are staffing levels in your 6 areas right now? Are all positions filled? Do you have a lot of openings or struggles to fill positions?
Are you speaking of corrections?
All.
Or generally
Yes.
across the agency?
Yeah.
I'll cover some of those items. In general, the vacancy rate's about 8%, but averages can be misleading. Some areas are higher than others. So we do look at it at a granular level of the departments and then within certain jobs within those departments. So there are 3 areas that are really the focus item based on higher vacancy rates. So at the psychiatric hospital, that has been a higher vacancy rate. We are seeing a really positive shift though. So the vacancy rate has been covered by traveling nurses, but the shift we're seeing is there are more in-state Vermonters applying for positions and accepting positions, and that's really encouraging. So we're starting to see that come down. The other area we focus on is corrections, which in general has a vacancy rate of 15 to 16%. But the correctional officers themselves is a higher vacancy rate, about 18%, which is not unusual from a national perspective, but it is certainly very challenging. The third area that we focus on that has a higher than average is the family service workers. Part of that family, part of the Department of DPF. I was trying not to do the acronym. To learn families, and their vacancy rate is about 11%. Thank you.
Can you talk a little bit about any steps that you've taken addressing the Department of Corrections burnout? I have a lot of very close connections in DOC, especially at where I am with the local prison, and there was a burnout. It's been a major concern.
So before we send that to the secretary, I just want to let you know that we are not the committee of jurisdiction for DOC. However, I do serve on the Joint Justice Oversight Committee, which does have jurisdiction, and we've heard a huge amount about the very question you're asking, and it's pretty critical. So, but it does happen in institutions in here, sometimes judiciary and in the House institutions. But I'll let the secretary answer the question, but it's one of these rabbit holes that we could go down. That's really, we are very concerned here about workforce, obviously, and we may pick up some of that, but the corrections itself is.
You don't need
No, we're good. No, it's a good question.
because I have other questions too, so we can ignore the DOC
But
question.
the reason it's a good question is that now the secretary is hearing it from another senator. It's very important.
And I think I'll highlight where it overlaps with this, with this committee. So we know Vermont's got a demographic challenge. We've been talking about that clearly. It impacts our health and human services to a pretty significant extent, whether we're talking about family services workers or the Department of Corrections or our healthcare facilities. And we've got both, I want to be clear, we've got the Vermont Psychiatric Hospital. We've also got, which is a psychiatric hospital. We've also got River Valley administered by the Department for Mental Health, which is a residential care facility. When I think about the Department of Corrections over the last few years, coming out of the pandemic, we had a very high, about double what our vacancy rate is right now. And we recognize the impact that was having on the health and well-being of both those who are incarcerated and those who work for the Department of Corrections. So in their strategic planning process, the Department of Corrections has identified the health and well-being of their staff and the health and well-being of the incarcerated individuals as a key priority. I'm sure that Commissioner Demo will be happy to come in happen to speak with you at any point about what they're doing, but they've implemented things like 12-hour shifts, which have helped us achieve that halving of that vacancy rate, wellness programs for their staff and their employees, and a host of mental health and other supports for their staff and their employees. And I can go offline into more detail of what those look like, but we take very seriously the mental health and well-being, not just of Vermonters, but a second priority of the agency is of the staff across our agency and Department of Corrections, Family Services, and Vermont Psychiatric Hospital have been highlighted for us to do that. We've addressed pay-related issues. We know it's not enough, and we continue to strive to address the health and well-being of our employees.
I'm going to pull on that thread a little bit more just before I get to the next department, but you can stay here. As far as the Vermont Psychiatric Hospital vacancies, we're about to fully shift away from travelers, and hire enough staff to open up our remaining 4 beds, which means that all beds in the hospital will be open and available to Vermonters in need. So when you think about kind of the impact, the human impact of especially Medicaid members, which is where my brain often goes, but to all Vermonters, those 4 beds have an incredible amount of meaning in a state our size. So it's the amount of work that's gone into supporting staff within these facilities is tremendous, and we're really starting to see the benefits of all of them. So thank you for that question.
And so, but since you pulled on that a little bit, no, that's okay. One of the things I want to say as we move through the departments, when you look at Department for Disabilities, Aging, and Independent Living, and you look at Department for Mental Health, which we just went through, I want to point out that they wear 2 hats, as does Monica. One is ensuring that we have the services that are needed, like Department for Mental Health, for all Vermonters for mental health. And the second is to ensure our most vulnerable Vermonters, and particularly those who are on Medicaid, get the services that they need. And so our departments will always wear, most of our departments that Monica works directly with will always wear those 2 hats. And so it's important to remember they have a role, whether it's regulatory or whether it's assessment and monitoring. They have a role that does both of those things, both all Vermonters and Vermonters with the Medicaid program. But speaking of Medicaid,
and I want to correct the record.
Do you have another question?
I had a question about DMH and vacancies, but we can move on.
No, go ahead and ask it. And if it's gonna be 100 minutes long, we'll know that.
It might be.
Yeah, go ahead.
No problem.
we're always happy to have one of our departments.
Ask the question.
Right, yeah, I definitely would actually, yeah, that would be lovely. So no, in filling the vacancy rates at your psychiatric hospital, and also across DMH more broadly, can you speak on a little bit about about any relaxing of hiring requirements and whether or not those vacancies are being filled by qualified individuals? I work under DMH, so I see a lot of it very firsthand. I just didn't know, like in the facility I work in, we've had to relax the hiring requirements over time simply just because there are not enough qualified individuals able to fill those positions. And I would certainly like to see anything that can be done about interagency training, when there isn't any opportunities for individuals in one facility to be trained up to a certain standard, just because of patient or client intakes, if there isn't anybody available, to move those people or those employees to other areas so they can get training in other areas of mental health. So that way they can help them in their original facility.
Yeah, well, thank you for highlighting that recommendation. And again, I think the Department of Mental Health is always happy to have additional conversations. Broadly across the agency, one of the things that we've done is to really take on an effort to look at the credentials of the individuals that we hire and to make sure that the credentials actually align with the positions. We have found that there are some that they're way out of line, and it doesn't allow us from an equity standpoint to ensure to get the best candidates in from the most diverse backgrounds. That said, when it comes to things like the Vermont Psychiatric Hospital and the core services that we do, many of them are regulated, and it's really important for us to ensure that we have the right training and the right background for individuals to fill those positions. And so Vermont Psychiatric Hospital is a perfect example. They're a hospital, they're regulated by the Joint Commission. And so to ensure the safety of our staff and of our clients, we do continue to maintain a high level of proficiency and qualifications for our staff. So I just want to clear both of those things up, both from an equity standpoint. We are looking to make sure that our positions align with the credentials, but also at the same time are ensuring that the credentials of the individuals who are coming in meet the needs of the clients that we have from the safety standpoint. But I think at this point, it makes sense for us to move on so we can get through the departments, and we'll move over to the Department for Vermont Health
I
Access.
have just one yes, no question.
Okay.
Have we ever been able to staff to open all the beds in the psychiatric hospital? I know we had trouble at the beginning, staffing up. I've just heard over the years.
I have to go back and look at the actual numbers from prior to the pandemic.
Right.
Since post the pandemic, we built up gradually, and we've been at about 20 or 21 beds. If we can get you the specific data.
No, just wondered if that.
And right now we are opening back up. We are working to open back up the last 4 beds.
Yes.
And we're able to do that because of the hiring and the good work that the NHS done on that. I know it's not yet to know, but
No, I've just heard it over the years that there has been an issue from the very beginning with staffing that hospital.
there were some issues at the beginning. I believe that they got pretty close to opening the beds prior to the pandemic, but the pandemic for all healthcare institutions and all of the that we work with, whether we're talking about long-term care or hospitals, whether it's mental health or general hospitals, staffing has been a huge issue. But to move on to the Department for Vermont Health Access. But before we do that,
I think I said age well when I was talking about one of the programs that is coming out of the Department of Disabilities, Aging and Independent Living. That's really addressing, it's age strong. I was thinking the national framework, so sorry about that. In case you wrote it down, it's age strong. It's worth a Google. The Department of Vermont Health Access. Medicaid, this is where sort of the basic Medicaid functions of our health insurance mechanism live. It's where I started in state government. I was a nurse in a hospital for a really long time, focused on pediatrics. Never thought that I would fall in love with state government, and this is where it happened. Their mission is to improve Vermonters' health and well-being by providing them with access to high-quality, cost-effective healthcare. So just like many health insurance companies, this is where you would see your members come to enroll into an insurance company, figure out what kind of service they need and order for what type of coverage they need. But remember, this is serving our most vulnerable Vermonters. These are people that might be lower income or have a disability. And this could also be people that are in between jobs. So if you're switching jobs and your income is decreased significantly for a while, Medicaid can help bridge that gap. We also see this pretty commonly in younger adults who are no longer eligible for, say, their guardians' health insurance, and they're still looking for their job or contemplating their next move. So Medicaid can really help fill that gap. And in our Department of Vermont Health Access, they do all of those functions like enrolling the members, but also measuring and monitoring the quality and assurance of the services, working with our provider network to make sure that they've got their needs met, and also monitoring for things like fraud, waste, and abuse, which are all federally mandated buckets and things we have to do as part of the Medicaid program, which is a federal and state partnership.
Department of Vermont Health Access also manages the healthcare exchange. And so they are the ones who administer the plans there for the small group and individual.
I think I've got one more. Great, yeah, okay. And then the Vermont Department of Health. So the Vermont Department of Health, also commonly known as VDH, their mission is to promote the physical, mental, and social well-being of people in Vermont by advancing equity, protecting against disease and injury, and preparing for health emergencies. Vermont, there's probably nobody in Vermont that Vermont Department of Health doesn't somehow touch or impact. If you've known a newborn I'm pretty sure all of us have. Every baby born in Vermont gets a newborn screening for over 30 genetic disorders and illnesses. They also get a hearing screen. So, Vermont Department of Health starts at infancy. It also helps support some of our chronic diseases and really thinking about how we can bend the curve there around things like tobacco cessation, for example. They also are the home of our substance use disorder program. The Division of Substance Use there, as the secretary referred to earlier, is a huge body of work that we're focused on. A big priority for us is to recognize and address the fact that we know that the vast majority of individuals with a substance use disorder also have a mental health diagnosis. And so how are we as a system making sure that we're best helping people that have both? And just to layer on another bit of complexity there, that's the same in our justice involved population, our population that might be involved with the corrections. So it's really important for us to be thinking about these people as whole people that have multiple needs and how we as an agency serve them holistically. And the Department of Health has a huge presence in our local offices that we talked about early. So they've got nurses in each district giving out immunizations, helping do WIC visits. That's the Women, Infant, and Children's Program. So that's for families that may have lower income that need help with things like formula, diapers, getting that primary care doctor. So they're very much on the ground and helping us think about things as a whole at the state level.
You heard us before talk about the collaboration between departments. Monica mentioned substance use. It is the Department of Corrections and the Department of Health who worked really hard together. I think that Vermont was one of the first that is providing medication-assisted therapy in our correctional facilities. This year that they've been working jointly on getting peer supports in our correctional facilities for substance use. So what you see is a significant level of collaboration that derives supports and services across department lines. And those are just two examples.
All right, so the last department we'll go through is the Department of Children and Families. And of all the departments we've looked at, this really has the broadest book of business. So many different diverse services they offer. And the way I think about it for Department of Children and Families is really two arms to it. There's an arm of caring for the children, and then an arm more of the financial side of it, financially caring for the families. So Department of Children and Families has 6 divisions within it. One is the Family Services Division. So this works directly with children and families and making sure children are safe. The other division, kind of in that caring for children, is the Child Development Division. And they partner to provide childcare services and development services to families and children in the community. And then we kind of shift over to more the financial side of things, caring for children and families. And when we talk about families, we also mean families can be a household of one, so as well as individuals. So we have the Office of Child Support, and they just celebrated their 50th anniversary. So the Office of Child Support is largely responsible for establishing parentage with the child to parent, as well as ensuring child care payments are met and monitored. Another division is the Economic Services Division. So again, this is providing economic assistance to Vermonters, whether it's food or heat, housing services, as well as that wraparound case management. Another division is the Office of Economic Opportunity, very similar in nature, but this group works and provides grants, community partners. So when you think of shelters within the state of Vermont, the grants for many of the shelters are coming from that area, Department of Children and Families. They also do some really exciting work on weatherization. So providing grants for people to really insulate their house so they don't have heat loss. So it's really exciting work that they do there. And then to bring it home, the last division in Department of Children and Families is the Disabilities Determination Services. And this group tends to fly under the radar, but they provide the determination for medical eligibility of disabilities. And they tend to be a leader nationally for their accuracy and timeliness of that determination. So that's a very high level, broad overview of the Proctor Insurance Company.
I'm gonna ask a couple questions right here. I think it might be helpful. We've been hearing a lot about Medicaid and we're gonna hear a lot about healthcare. So somewhere in here lives, the Reach Up program. And somewhere in here lives autism and integrated, eligibility determination. And so can you, and we're gonna hear about these things, so can you talk a little bit about the Reach Up program, where it lives? And I do have another question, so when I have, that's two. Integrated eligibility for how, you know, I think it's probably down there around the determination services and how that coordinates with families and schools and local organizations. Some of these things are the things that we hear about when we go home. So,
Yeah, I'll start with the integrated eligibility and enrollment item, if that's okay. So that is really to determine services for Vermonters for both healthcare as well as economic services. So it spans multiple departments within the Agency of Human Services. So they work together. That's why it's integrated eligibility and enrollment. And part of that is housed, the healthcare side is housed in the Department of Vermont Health Access. The economic services side of some of those benefits is largely housed under the ESD, the Economic Services Division within DCF. There is a major project underway to modernize exactly integrated eligibility and enrollment, which is well overdue. That's it.
okay. And then Reach Up. Yep.
Oh, and Reach Up also largely under the Economic Services Division, and they provide really comprehensive case management and wraparound services to assist Vermonters on what are they eligible for and really navigating that whole system.
And particularly families with children.
And particularly families and children.
Yeah, okay. So, I mean, a couple of years ago, we had a restructuring of that, maybe 4 or 5 years ago, geez. But it might be helpful at some point to have more information on Reach Up. I think there may be a discussion.
Yeah, so employment service, ensuring that individuals have all the economic services they do, providing employment supports and services, particularly for our most vulnerable families with children who are really struggling. I think it's worth noting that within economic services, we're trying really hard today not to use acronyms, but you will hear a few acronyms associated with them. You'll hear SNAP, which is and 3 squares, which are food benefits for Vermonters. It helps Vermonters who meet income eligibility access food generally through the grocery store through an economic benefit. You also hear HANA as a program and fuel assistance and support. So really rich economic supports that try to cover food, housing, and heat across that division. The great thing to go to your question, the good thing is with them all being in one division, they're able to ensure eligibility and enrollment for most of those programs at the same time.
So I do have 2 more questions. I don't want to preempt everybody else, but just, we will be taking testimony or hearing. The House will be starting, I think, on the GA housing issue. Where does that fit in all of this?
Yeah, the GA housing program, I want to be clear to everyone, is an economic benefit. It provides emergency housing for individuals that was always intended to be a backstop and short term. It provides a direct access to a hotel room. Originally in the program, it was for 28 days. The program has evolved significantly, and I'm sure DCF would be willing to give you a comprehensive history of that since the pandemic. That sits within the Economic Services Division. I heard you sound like you were going to say,
You covered that perfectly.
That's good. And then my other question is an area that I'm hopeful we'll get into a little bit in here. And it will be something that in the past we've worked with the Committee on Education Committee on kids with mental health, and how do we support? What services can we provide? And I know that there's a foot, 1 foot in AHS and 1 foot in AOE. And where is that now? How does it fit? And just a heads up for you guys that we will bring folks in to talk about kids and mental health, especially the middle school challenge that we have and the challenges the DAs are, how DAs can support services. But any update on that between AOE and AHS and how everything?
Before I turn it over to Monica, who I think will be well prepared to answer that question. For those who are new, I just want to make sure we've used the term DA a couple of times.
Oh, yeah.
It's the designated agencies. So at the local level, across the state, we have nonprofit agencies who administer safety net. So for those who are most vulnerable, mental health services. Some of them administer substance use services, and then services for those who have developmental and intellectual disabilities. You'll hear us talk a lot about those as designated agencies, and it's because they are designated by rule and statute to cover a certain group of services in mental health, substance use, and developmental services, as well as to cover that in a specific geographic region. So you'll hear that a lot. The agency is for each type of service, whether it's mental health and substance use or healthcare services, has these geographic regions. For this case, designated agency, mental health, some substance use, and developmental services. Sorry, Chip.
No, that's great. Thank you.
Once you start talking about these things, you realize how much background information is helpful as these discussions emerge. So the work in the mental health space, especially for kids, is deeply interconnected between the Agency of Education and the Agency of Human Services, specifically our Department of Mental Health and within our Medicaid program. We have recently really started to dig into how we can, as a Medicaid program, be supporting the mental health services and really all school-based health services as well for students in our education system. Through this discovery, we've realized that while Vermont tends to be a front runner in many things, we've fallen quite behind here. And so we're working diligently to fix that. We're working with an organization that's helping us update the way that we're actually paying for school-based services in the school that are health related, including mental health. And that should actually help us generate a lot more money to be sending into the schools, to be increasing the number of services, the quality of services, and the types of services that we're delivering to kids in schools, because we know that that's where they spend most of their time. That's where we know we have them as a captive audience. And it's really important for us to capitalize on that time when they're in school, so that they can interact in that space better, but then also go home and feel better.
I want to be cautious on a lot more money. What Monica means is that we've identified that there are some healthcare services that are being provided in the schools that we could get that are Medicaid services that we're not using Medicaid funds to cover, which allows us to create match. As we talk about our Medicaid program, it's really important for us to caution that every new Medicaid service that we authorize, that there is a match of that is approximately 45-55%, depending on what service it is. It depends, but there's a match rate for that. And so for every dollar we might want to put in, the state will have to put in 45 cents on that dollar to the federal dollar. So I want to caution us that from a budget standpoint, we always will have to have the state dollars matched with the federal dollars. In this case, what they've identified is that there are some state dollars that we're not yet matching.
And so that we don't want to leave federal dollars on the table.
No.
That's true. And
But it's not a whole bunch of new money.
and I just have one more question of you, and that is, we will be taking this up in here, and so it would be great to know if there's a time frame for you, because you're working on this, and so we can bring you in and get some where you are.
Yeah, we would be happy to come in, and we would be even happier to come in with our colleagues from the Agency of Education.
Exactly.
Because we work very closely together and hand in hand. So I just want to emphasize the level of alignment and collaboration across agency boundaries.
So on topic, these are things I've been grappling with because I have had multiple conversations with constituents and folks across, the spectrum. That folks want the mental health piece of the education pie to sort of be removed from the ES fund and placed into the general fund for one thing. And then I've heard that that's way more complicated than it appears, just because it's not always clear who's delivering what service in schools, and it's sometimes there's a lot of gray area. I also have folks who really want us to be pushing services into schools because that's where the kids are. As you said, that's where they are, and like meet them where they are. And then other folks who say, yeah, but then they go home on the weekend and they don't have the services they need over the weekend, and they come back on a Monday and they drop back, I'm just wondering if you all have, a comment or any thoughts on those complicated issues.
I think the education funding piece is more complex than we'll be able to get into today. Happy to come back on that one. I think everyone is aware that one of the key priorities this legislative session for the administration is looking carefully at the education system. As the governor highlighted when he spoke last, and as Secretary Saunders spoke, a component of that is really looking at school-based health and in particular mental health services. So it is on our radar screen. It is a high priority. How to do that is going to be a question. In our mental health space, the demographic issue and the workforce issue is very real. And so we're excited to partner and collaborate with the Agency of Education on really trying to rethink how we maximize the workforce that we have and how we ensure that that's still connected to our community-based resources and our schools at the same time. So education is a priority.
This is good. And because Senator Gulick's been involved with us pre-Senate and then in Senate Ed and in here, we're very interested in how to make this all fit together. So it'll be just great having you come back in with your colleagues, and we would like to be part of the solution. I guess that's what I'm saying, but we don't have a solution to offer right now, but we certainly have a conversation. Want to keep
Definitely as part of it.
Well, and I wanted to comment on what I heard you say about some families feeling like services in school are the right fit for them or outside of school. And, when we think about kids on Medicaid, and, I spend some time in our call center, and sometimes I just listen to the calls and I say, don't worry, there's somebody very qualified next to me who's going to help you address your issue here. So I don't know all the answers, but when I talk to some of those families, I hear, especially from the Medicaid members, that the relief of knowing their kids have access to those services in the school is significant. And so thinking about ways that we can leverage federal dollars that are being left on the table, not a whole new bucket of money, got too excited.
It never is.
That we are making sure that kids on Medicaid have access to really high quality services where it makes the most sense for them. And that's not always the right place for every family. So it's that case of variety is the spice of life, right? I'm a parent, I've got 2 kids in school. When I have the opportunity to get services in the school that somehow allows me to be a parent outside of our other world, work and parenting and school, that's great. So, but it's not the right fit for everybody. So making sure that we can provide options so that all kids get access to what they need is really the name of the game here.
Thanks.
This will be great. This is good. And then, do you have other things that you wanted to share with us, or are we just at the question and discussion stage?
I think our goal today was to make sure that we provided just enough information to get folks started. So I don't have any specific additional things. You have heard a little bit about what our priorities are, though. Mental health and substance use, and particularly co-occurring care in that space, is a key priority for us. Housing, and particular, and for I want to make sure that everyone knows the position of the agency. Housing unit generation is at the forefront, but our agency is also working to look at how we do this, how we are the safety net for individuals. Looking at our systems of care and continuing to innovate is a high priority for us as an agency, so that you'll see that in the reform work that we're doing in the healthcare reform. So stabilizing that healthcare system. I heard the healthcare advocate talking about that before. That is a priority for the agency, and we've been working hard at that behind the scenes. And I think importantly, our workforce, ensuring that we've got not only on the external, but inside of our own agency, that we've got a healthy workforce whose needs are being met. So those are some of the key priorities. Did I miss anything? No.
So, but I do know that in terms of the healthcare reform, and we've been working together on that between you and Freeman Care Board and the legislature, and putting together some recommendations that will help us move forward. We will have you back on Act 167, which I know is a real important issue in our communities in terms of healthcare transformation, hospital transformation, global budgets, community services, and so on. It will be great to have you back in on that. We're talking about establishing priorities relative to that work. One of the priorities that we'll be talking about, obviously, is financial reimbursement and payment options. Will also, I think, very importantly, is looking at electronic health records, EMR, and how to have interoperability in other areas. So, and I have talked with the Director of Healthcare Reform recently about that, and shared some of my thinking on that, and the committee will be talking about that going forward and hearing from some national and local experts, so that we get some data and factual information on things like reference-based pricing or block grants or whatever we need in terms of going forward and decision-making. And we aren't the ones that regulate, and we're not the ones that set the conditions for regulation. What we can establish principles and put those in place. And I look forward to working with you on this stuff. So just to share that from the committee perspective. And I know we've talked about it before. Not new news, right? Well, committee, any questions or comments? I think there's a lot. There's a lot of work sitting in front of us. We've got these three people who represent a huge amount of work that's going to come into our committee.
About half of state government.
Huh?
About half of
state government. But we also learned today from Nolan Langwell that all of the money that goes into AHS isn't expended through AHS. It goes to other agencies and departments. So
I just like to thank you ladies for being here today and doing everything, explaining this out to us. Said we had a wide between him and the mental health and recovery system, the coaching stuff. I put my little itinerary on the back of my card for you. So if you guys need any assistance whatsoever on weekends when I'm not in session, I'd be more than happy to work in the correctional facility or whatever you need me to do. I can make a trip. I live from St. Johnsbury. I'm only 30 minutes away, so I could run up there if you guys ever need any help at the correctional facility. But I really appreciate everything. That was a great slideshow, and you guys spoke with Elliot. Really impressed. Thank you.
Thank you. It's great. Thank you very much. Any other comments, short comments?
Thank you for having us.
Thank you. This has been very good. I know there's a lot more detail that we could get ourselves into trouble on.